Hello, and welcome to another edition of COVID Conversations. I'm Harold Fisher. I was really recently asked, do we really still need to talk about COVID every week on this podcast? Is there still a need for COVID conversations? Well, my guest today would say absolutely yes. And here's why. We start this week's discussion, as we always do, with the latest COVID numbers. According to the latest statistics from the CDC, coronavirus cases are up nearly 25% in the past week, with more than 90,000 infections daily. The fatality rate is also up 13%, with 324 deaths daily, and hospitalizations are also on the incline, jumping more than 19% in the past week. But here's what's down. Vaccinations, COVID doses dropped more than 8% in the past 7 days. My guest today is on a mission to push friends, family, and loved ones to not get complacent and to take the COVID shots. Dr. Tanoa Hampton is a doctor of strategic leadership, a registered nurse, and an ordained minister. Dr. Hampton is also the program facilitator for DC Grandparents Against COVID. Dr. Hampton, thank you so much for joining the conversation.
Thank you for having me today.
I am constantly hearing from people that they want to put COVID behind them. Certainly that's understandable. And there's no need to continue talking about this virus. Your thoughts about that?
Well, I think that's a huge mistake we're making if we're not going to continue those conversations. You just gave us the statistics, and it's vitally important that we continue this conversation and we continue the push so that we can really get back to our new normal and really begin to see our friends, our loved ones, our grandparents, and do the things that we need to do for our total health and well-being.
You said new normal. Define that for me.
So I don't believe that we're actually get back to doing things the way we did prior to COVID. We do know that there were some benefits for many people who got to work from home and things of that nature. But at the same time, we have to have respect for this virus and the way that it's transmitted, which means we have to not let down our guards. We have to continue safe hand washing practices, continue to be mindful of our sneeze hygienes and things of that nature as we interact with one another. So it's going to change the way we do things, and we have to keep it in the forefront of our mind, because if we don't, we'll go back to old practices. We'll sneeze in our hands. We won't continue to wash our hands between interactions, touch doorknobs willy-nilly, things of that nature. So I think it's going to really require us to continue to stay vigilant about just some standard precautions that's related to transmission of disease and things of that nature.
You are with a relatively new organization named DC Grandparents Against COVID. Talk to me about the organization, the mission, the purpose.
So DC Grandparents Against COVID-19 is the program that was developed by Help Age USA. A couple of years ago, at the beginning of the pandemic, they began to do some research to look at COVID vaccination rates and boosting. And doing that research, they determined that there were some gaps. And in those spaces of the gaps, it was really in the spaces of conversations that were needed to be had by in our community, and particularly Blacks in Ward 7 and 8. As a result of that, they had more conversations, and the grandparents, the elders in those communities say, hey, we really need some assistance, some help. We would benefit from some help in having these conversations. Sometimes the generational divide is too great. Sometimes we don't want to be too pushy. And other times that space of tough love just doesn't work in having these conversations. So as a result, the birth of DC Grandparents Against COVID-19, a movement of grandparents in the District of Columbia that's with the goal of encouraging our loved ones, friends to get vaccinated and boosted.
Do you think it's working? Are they getting the message?
I think it's working, right? Because if it's just one grandparent that is empowered to have that one conversation, what we know is that that will have rippling effects. But what we've seen so far in just this short period of time, we have over 100 grandparents who have decided to join us in this movement. And we're daily having conversations with our seniors and providing them with the resources where we're actually seeing them become more comfortable having the conversations with their grandchildren, their children, and even in some cases their peers, because they're finding out in some cases even their peers aren't vaccinated and boosted.
Yeah, and that was my next point. I was wondering, what is the biggest challenge with seniors in getting them to be a part of this anti-COVID movement? Because we are now what, 2.5 years in.
Mhm. And so I think part of the problem for some of our seniors is they feel some have done their part, right? I've done
Mhm.
my part. I'm vaccinated and boosted. So that's typically the first thing I hear from a grandparent when I approach them to talk to them. I'm vaccinated and boosted. And I go on to say, but this program really isn't just about COVID. It's really about those health conversations that are needed in our community. And sometimes it's going to be starting at the space that they're able to be vulnerable and honest with their loved ones before and build that trust that you're respected in your care before we can even have the COVID conversation. So what I found is that helping them understand that my goal is to assist you in being able to have some of the tough conversations. And I want to work with you through building trust, expressing empathy, right? And really finding the real reason why people don't want to be vaccinated. You can't offer them a solution if you don't understand their reason for either hesitancy or resistance.
Mhm. You know, you're well aware that seniors were hit especially hard in the very beginning of the pandemic. That hasn't really changed much. It's one thing for seniors to talk to their senior peers, but do they have a message to the larger community? And if so, what do you think that is?
Well, we know our seniors' voices matter, particularly in our community, right? They're our trusted voices. They're our big mamas. They're our big daddy. That's Uncle Joe. And I think, they were hardest hit. And many of them have been isolated from their grandchildren, children, their nieces, and they really want to get back to that space. So I think in us giving them, the words sometimes, or even just the space, and sometimes it's just holding the space for them to be able to be authentic about their own fears, so that when they begin to have the conversations with their grandchildren and children, they can find some common grounds in why this is important, not just for them but for the greater community at large. And our grandparents, they're phenomenal at doing that. They've seen some things, and some of us in other generations haven't quite lived long enough. And if we're able to help them have these empathetic conversations that really draw the next generations in, I think our community, one person at a time, one family member at a time, will be transformed, and we'll begin to see the effects of it, and more people getting vaccinated and boosted. But we got to first build that place to say, I have mutual respect for you, but let me give you some information that will help us in the long run to keep our community sustainable.
Mhm. What do you believe is the call to action going forward for this particular constituency?
So the call to action is empowering their voice, right? Your voice matters. Join the movement to use your voice, right, to make the change in our community. So what do I mean by that? I empower you to say, enough is enough. We want to get back to normal, but this is how we're going to do it, through love and compassionate conversations, so that we can really begin to see the change that we need to see with relationship to the COVID numbers. And, these go back to mass, don't go back to mass. We really want to get past that place that we have a space that we can really begin to live again. And I think that that's important to our mental health, particularly for our seniors.
Hmm. Another point, you are a nurse.
Mhm.
You're a nurse. Can you at least briefly talk to me about the evolution of COVID as it relates to you as a nurse, and some of the challenges and victories that you've seen over these past 2 years?
So, interesting that you asked that. So, I've been a nurse for over 25 years, and the seniors have particularly been my community that I have served. And I had the honor of serving as the executive director for the DC Board of Nursing at the height of COVID. So, when it first rolled through our doors, I was challenged with helping the nursing workforce move forward as they, as you know, were on the front line doing the work. And so we saw them, really be our heroes. They sacrificed times with their family and their friends, and many of them got sick, and some of them had to deal with their own mental health. And we've helped get through some of those moments. But I know that we also were some of those that were impacted by not being able to have significant number of healthcare workers. So
Mhm.
that was some of the challenge that we've seen during the pandemic, which really impacted our communities, particularly for those who are aging in place, since DC does have a commitment to allowing our seniors to age in pace and live where they're most comfortable. So that space was very difficult in the beginning, but what we saw was the community banding together, regulators, practitioners, and the community coming together to address the needs related to ensuring that our seniors and those who needed assistance were getting registered for the vaccine, were able to get the vaccines, or providing transportation. So we saw a huge push for people to get involved in spaces that they didn't. So volunteerism from various spaces. So those were some of the things that we saw at the beginning. Where are we at now?
Mhm.
Healthcare still hasn't given up. They're still showing up every day and trying to find creative ways to be able to engage and ensure that people get vaccinated and boosted. So we know we have faith in health initiatives. So to engage the faith community, we're with our program, DC Grandparents Against COVID-19, we are engaging our senior communities. And we most recently did some intergenerational conversations with some um, 30-year-olds, 18 and 20-year-olds in conversation, just to hear their point of views, right? To get them involved. And it is making a difference, not as much as we probably want, but guess what? I think we're seeing some movement as people are taking some personal responsibilities in our community, but yet there's still so much more to do. We cannot get complacent. We can't let our guard down, and we can't stop doing the work. We're going to have to keep pushing to make sure that everyone gets vaccinated and boosted. And as the science evolves, right? Because medicine is the practice. So there's not an exact science to it. As it evolves, we have to be willing to share that information and correct where there may have been either misinformation or disinformation that has been shared, so that people will, be able to make decisions that respect their one personal beliefs, religious beliefs, but also their things that are best for themselves and their community.
You said that you've been a nurse for 25 years, yet I think it's an easy argument to make that no one in the medical profession has seen anything like this. The only thing close to this would probably be the AIDS epidemic. But how do you believe that COVID has changed you personally? You were there in the beginning, you're still in the fight now. But from a personal perspective, how have you evolved and what is different about you now compared to BC before COVID?
So before COVID, I probably was more health focused on just the practice of medicine, the practice of nursing. And I think probably since COVID, I've become more concerned with wellness. And,
Mm,
and so not just making sure you get the vaccine, but let's also talk about your emotional needs, your physical, your mental wellness, right? Your financial well being. Because if we do not address those issues, people will not necessarily be empowered or find it a need to address the health issues because I don't have the money I need. I'm going to choose to do those things. So I'm going to go to work as opposed to make the appointment and stand in the line or whatever it takes for you to get you vaccinated or boosted. Or if I can't feed the children, right? I'm not really worrying about these other things called COVID. My focus is on my own well-being. And so I think what I have come to learn is not that health isn't important. I'm a healthcare practitioner, right? And I've committed my life to that. But I also believe now that we have to take a look at the other areas of health and well-being that COVID has impacted, that I believe ultimately is impacting why people are choosing to or not to get vaccinated and boosted.
Final question: how can people who are interested in DC Grandparents Against COVID get involved?
So how can you get involved? We're looking for 500 people to or more to join us in this movement. And what we're asking is simply this: agree if you're 60 and older, a district resident. Agree to tell 4 people about why it's important to get vaccinated and boosted. And then we offer weekly educational sessions that range from fake news versus real news, why is the vaccine still important, intergenerational conversations, active listening. So those are some of the topics that we're discussing. And so all we simply ask is that you register with us. You can go to our website, www.helpageusa.
Say that one more time, please. Mhm.
www.help, HELP, age, AGE, USA.org. And so right there, you can go and find DC Grandparents Against COVID-19. Our registration form is there. If you need more information, you can email me directly, thampton@helpageusa.org. I am more than happy to come out, speak with you, speak with your organization. If you have seniors that you believe are 60 and older that will be able to assist in this movement, we want to get the education into their hands. We want to be able to empower them to be advocates in the community for their health and well-being. And yes, we're talking about COVID today, but I promise you that the techniques can be applied to any health issue that's plaguing our community. So that's what we're here to do. So please feel free to reach out to us. It's vitally important that we help empower the voices of our seniors because their voices matter.
Dr. Tanoa Hampton, thank you so much for sharing your expertise and your insight with us.
Thank you, sir. I appreciate you having me here today.
And thank you so much for joining us this week for another edition of COVID Conversations, where, of course, each week at 12 noon, we bring you the experts to help us get beyond the double talk and straight to the facts. I'm Harold Fisher. Have a safe and healthy week.